Get mean to her, he can hook that leg and start to bring the heel towards the glutes. So this one, we're just pulling and opening up that hip joint, stretching out that TFL and that IT band. And he's just gonna roll it back and forth. And again, he's finding those knots and those tight areas. So he's gonna use the big roll for the quads.
Hey guys, my name is Katie with Oak Brook Medical Group, and today we're going to be talking about tight hip flexors, some of the causes, and then some of the treatments we can provide. So, tight hip flexors are generally caused by sitting for long periods, so if you have a long commute to work, or if you have a seated desk job. We have running, so if you are a runner, long periods of running can do that to your tight hip flexors. Working out in general, or poor posture. So, some of the treatments we can provide for tight hip flexors would include stretching, functional exercises, and also active release therapy. So, stay tuned for the next set of videos where we go more in depth on these treatments.
Hey guys, Dr. Mike, Jose, Katie here, Oak Brook Medical Group. So today we're going to go and do a little video for you guys on tight hip flexors. We've seen a ton of patients coming in with this. A lot of people are working from home now, working at a desk, so there's a lot of sitting that's going on, and all that does, it starts to tighten up these hip flexors in the front. It can start to actually cause low back pain. So we're going to show you guys a couple stretches at first, as well as some other things with these upcoming videos, so make sure you're paying attention. So Jose, go ahead and let's start stretching out Katie here. We'll walk through what he's doing and what he's actually hitting.
You're going to lay down here. You're going to fix the window for that. Come back here so we hit my side.
Good. So again, there's lots of different ways you can stretch patients, especially the hip flexors. This is just one of the ways. We're always going to do what is most tolerable to the patient, where they feel the most stretch. So what Jose is doing here, he's actually going to brace that low back and then start to pull and stretch all of these muscles in the front. So the hip flexors are a group of 5 different muscles. So we want to make sure we hit each one of those being the rectus femoris and the quads. So not only with this stretch can he stretch that front of the hip, but he's controlling her knee and her ankle in the back here, so he can actually pull on that quad as well to start to stretch that out. So that's one of the ways that we can hit that. And again, there's a couple of them. We're going to walk through one more for you guys. So when it comes to the hip flexors too, the other thing that we're going to focus on is we obviously want to loosen up that entire capsule, right? The hip flexors, the hip joint, everything like that. So you've got a little muscle on the side of the hip here called the TFL, the tensor fasciolata, that runs down into the IT band or the iliotibial band. So this one, we're just pulling and opening up that hip joint, stretching out that TFL and that IT band. Again, not necessarily part of the hip flexors itself, but that whole hip's connected with all those muscles, so we want to make sure that we get everything nice and loose in there. Perfect. Doing great, Katie. And then the last one here, we're going to drop you down to the end of the table here, if you could for us, please. So again, hitting these muscles, same way, doing the same thing, but we want to make sure that we do what's most tolerable to the patient and make sure that the patient feels the best stretch. So with this one, Jose is actually to be able to get into the stretch a little bit deeper without affecting the patient's low back if it does cause low back pain. So with Katie sitting at the end of the table here, Jose can brace the one knee to drive up while he's pushing down on the hip flexion and the quad on that side. Again, opening up that hip. And if he really wants to get mean to her, he can hook that leg and start to bring the heel towards the glutes, which is going to stretch out the quad a little bit more. So again, we can be as specific as we want to with this. We can get as deep of a stretch as we want to. It's all patients, you know, what they can take or what's most tolerable for them. Hey guys, Jose, Stephanie, Dr. Mike here, back at Oak Brook Medical Group. We're going to go a little bit deeper into the tight hip flexors. All right, so I want to show you a couple more modalities that we use with our patients just to really help open up those hips, loosen them up so we can help alleviate some back pain too that the patient may have. So Stephanie's going to go ahead and lay down here. The first thing we're going to do is basically what's just called pin and stretch. So everything we're going to do here is all soft tissue mobilization. So pin and stretching is exactly what it sounds like. Jose's going to work into that hip flexor. He's going to find where the tight muscles and the tight knots are, and he's going to do just like we talked about. He's going to pin that muscle down while he brings that leg out and stretches it. So Stephanie's going to bend her knee. Perfect. So you can see Jose's got his hand there, he's pinning the muscle, and then he pushes down and pins it as we stretch those hip flexors and open up the hips. So he's gonna relax, and pin, stretch that muscle out. Again, we're just gonna work through this in the patients, both hips, get it anywhere from 5 to 10 times until those knots really start to loosen up. The goal for this and the next modality we're gonna do is all for breaking up that scar tissue. Perfect. Put that pressure down. All right, so the next thing he's gonna do is what's called body tempering. Easy way to think about body tempering is foam rolling on steroids. Easy way to look at it. So he's gonna use this big old bar right here. Is this a 22 pounds?
Yeah, 25.
25 pounds. 25 pounds. Don't throw it at patients.
Don't.
Terrible idea,
Yeah.
right? So we usually use that with a little more caution.
I was trying to be cool.
But it's a 25-pound bar, right? So, and he's gonna do the same thing you would with a foam roller, right? And there's a lot of back and forth with foam rolling out there. Truth of the matter is there's a lot of good research on foam rolling for short-term results. So that's what we're getting. So with body tempering, he's just gonna let that bar lay on her quad, and he's just gonna roll it back and forth. And again, he's finding those knots and those tight areas. So he's gonna use the big roll for the quadricep, and then once he works that out, eventually he'll move into that hip flexor, and then he's just gonna use more so of the ends of that tool to get deep into the muscles of the hip flexors, right? We gotta remember, it's not just superficial. Those muscles are deep down in there, so we really gotta dig to loosen those up. This shouldn't be painful, right? You're gonna feel some tight muscles, you're gonna feel some tight knots. Jose's just gonna work long enough to break up that scar tissue so we can really start to open up those hips. With the body tempering, again, this isn't something you would wanna do just by itself, right? You don't wanna find a heavy bar and just use it at home. It should be used with a full mobility type plan, because this is gonna create a short-term result. So we wanna include stretching and other mobility stuff so that the patient can get long-term results and not have to focus on doing this constantly.